Greetings and welcome to this edition of Journal Club Fridays. And in this episode, we're going to talk about one of the papers of Dr. Fred Klenner, who was the first physician, to my knowledge, to begin giving really massive doses of vitamin C intravenously and intramuscularly. And starting with a paper in 1948 and then continuing on, he was reporting near miraculous sorts of results from this. And so I wanted to speak to you in person with the camera. I can't figure out how to get the camera to work. I'm a moron with this. I don't know even what you call it, vlogging, whatever the heck it is. And so I need to continue to get up to speed on that, not to bore you here, but I'm just saying I'm doing this actually after I went through the papers, and I don't know how good the audio will be, but if you can put up with that and get through that, I think the information hopefully is both interesting and useful. So maybe that's all for the best. And so here we have Dr. Klenner. He's kind of got the Leslie Nielsen thing going on there, doesn't he? And he's a graduate of Duke University, which is a prestigious medical school. And then he set up shop in North Carolina with a general practice. And I would have to say, I think at that time, the vast majority of physicians were general practitioners. It was sort of before, to my knowledge, before the age of a great deal of specialization, which is almost a prerequisite at this point. So this is just a bit more on his biography. And again, I went through the papers before doing this. I didn't see this one coming. Dr. Klenner was the father of a serial killer, Fritz Klenner Jr. He had, I think, 2 daughters and then this one son. And I was reading up on him. I don't want to get too far astray, but I guess this guy married his first cousin who was divorced, and then he ended up killing her parents, and then he killed the woman, the person that she divorced. He killed his parents and their grandparents, and then it's just very bad. And then he was the brother-in-law of the first woman Chief Justice of the North Carolina Supreme Court, which I guess is a little nicer. So how unfortunate and tragic, and didn't see that one coming. It should not detract from what he was noting in the peer-reviewed medical literature. And further, by this time, while not in the same indications or diseases, these types of results with large doses of intravenous vitamin C have been replicated numerous times at this point. I just thought this was a very good place to start, as he was the first one to actually give these large doses, but didn't see that one coming. Anyways, that's getting too far off topic, and without further ado, let's talk a little bit about vitamin C and then get into the paper that we're going to discuss. Okay, to get started, we might first just take a look at the molecular structure of vitamin C. So there it is there, and there's a 3D model. And I'll just mention in passing now that it looks a bit similar to another molecule, namely glucose, which is the most widely and easily used energy currency of human cells. It's not exactly the same. This is a 5-membered ring, and you have an O there, but you got a lot of carbons and you got a lot of OHs. And if we look at glucose, you see a 6-membered ring with an O there, and a lot of carbons and a lot of OHs. So there are actually 4 enzymatic steps to go from glucose to vitamin C. And most primates, well, wait a minute, reverse that. Most animals except for primates and a few others, interestingly guinea pigs, are able to convert glucose into vitamin C, and so they do a lot of that. They convert it in the liver, and they make large amounts of it. So like a goat under stress will, this is from memory, but I want to say it can make 40 or 50 grams of vitamin C in a day, just churning out of its liver, converting it from glucose. Humans lack the last enzymatic step to convert glucose into vitamin C. So that's sort of a little bit of molecular background, but let's just start, what is vitamin C? And back, especially back a number of centuries ago, when there were long ocean-going vessels, and this isn't the only time this problem crops up, but it notably crops up there, they noticed that a number of the sailors would develop a disease called scurvy, and not a pleasant disease. Your connective tissue begins breaking down, and so it'll start with things like bleeding from the gums and joint pain, but if it goes on long enough, it will kill you. And this was a terrible scourge for ocean-going navies with long trips. And so what was realized over time was that there was something in the diet that would prevent scurvy if sailors were getting it on the ship, and it was generally fresh fruits and vegetables. So one apocryphal, but I think it might be true, story was that there was a naval vessel, and sailors were dying. Some sailors were dying of scurvy, so they dropped them off on a tropical island off the coast, I want to say, of Venezuela, and then continued on their voyage. And they came back a couple months later on the return leg of the trip, and they found the sailors all in great health. And so they named it the island Curaçao, however it's pronounced. But over time they realized there was something in foods like sauerkraut, lemons, limes, hence the English Navy people being called limeys, and that would prevent scurvy. And that's about where things stayed for a long time, but there was a great deal of effort trying to find what is the component of the diet that's preventing scurvy. This is how a lot of vitamins are discovered. There's a deficiency state that leads to disease, and then it's eventually figured out what it is that prevents that disease. And so it was isolated, this is all from memory, but I'm pretty sure it's right, by a gentleman by the name of Sven Georgi. I don't know, maybe as far back as a century ago, and he had a bit of a sense of humor, and so they said, what should we call it? And so he said GODNOSE. He's saying, God knows what I found, But then they threatened to not give him a Nobel Prize if he did that, so he changed it. And he got the Nobel Prize for isolating vitamin C, and I think, although don't quote me on this, I'm a little less certain, that's how it got the name ascorbic acid for anti-scorbutic, scorbutic referring to scurvy. So it's either called ascorbic, anti-scorbutic acid, or ascorbate if it's the salt of the acid. All right, let's get to the meat of the presentation. So I believe Klenner published his first paper on this in 1948, but it's probably worthwhile starting in 1935, because at this point, vitamin C prevents scurvy, and you need a couple lemons worth a day of vitamin C and you don't get scurvy. And that's a far cry from taking 50 grams of it and sticking it in intravenously to someone. And so why was he doing this? That seems an odd thing to do. And I don't know for sure, but what can be said is that previously, if we go back to 1935, there was this physician Klaus Jungeblut out of Columbia University, New York, who did a test tube study, and he said that polio virus is inactivated if it's cultured with vitamin C. So, and we'll return to this later, that Jungeblut is saying that vitamin C, they first noticed that it had the power of inactivating diphtheria toxin in vitro and in vivo, so in test tube and in either animals or humans, in extraordinarily small amounts. So then they looked at it with poliomyelitis virus, and this is sort of a cross between a test tube study and an animal study. They took the polio virus and they incubated it in the presence of vitamin C, and then they injected 30 rhesus monkeys, and they noticed that depending on the dose that it was very active in preventing infection with poliomyelitis. Well, just to kind of keep the narrative going, let's go back to the 48 paper, which was on treatment of atypical viral pneumonia, and skip ahead to a 1949 paper of Klenner, which is the treatment of poliomyelitis and other viral diseases with vitamin C. And he's saying that other types of virus infections had responded favorably, and he's going to present those findings. Measles, mumps, chickenpox, herpes zoster, herpes simplex, influenza will also be discussed. And here he says the one thing that they were missing was the size of the dose of vitamin C employed and the frequency of its administration. And then he goes back to Jungeblut, who we just talked about, and that he had had failures using vitamin C as a treatment. But Jungeblut unequivocally said vitamin C can truthfully be designated as the antitoxic and antiviral vitamin. So he's saying that Jungeblut had it right, he just didn't have enough. So poliomyelitis is a truly terrifying viral infection that it attacks nerve cells, and it can either be mild with very few effects, or it can lead one with a permanent paralysis, as was the case with President Roosevelt, who lost the use of his legs due to an earlier case of polio. And if severe enough, it also paralyzes the diaphragm, so one can't breathe, and that leads to death. And they were using things like the iron lung at that time to try to keep people breathing in hopes that they would eventually get returned to the diaphragmatic muscles and be able to recover. So I will leave it to the viewer to read Dr. Klenner's excellent write-up on the pathophysiology of polio infection. But if we get down to here, so in his practice in North Carolina in 1 year, 1948, 60 cases of the disease came under his care, and they had all of the signs and symptoms classic for polio, high fever, and so on and so forth. These would have been well known to physicians of the time. And in addition, in 15, so a quarter of them, the diagnosis was further confirmed by a lumbar puncture, and then I would guess culturing of the virus. So the treatment employed was vitamin C in massive doses. It was given like every other antibiotic every 2 to 4 hours. The initial dose was 1,000 to 2,000 milligrams, so 1 to 2 grams. And we could say the maximum dose then that might be received would be every 2 hours, so 12 times 2 is 24 grams in a day, depending on age. Children up to 4 years receive the injections intramuscularly, and so a lot of this dose wasn't in full-grown adults, making the dose even larger. And so then he's saying they would keep track of the patient's temperature, and if the temperature was going down after a dose or the second dose. If there was a drop in fever, then they would give 2 more hours, so 4 hours before the second dose. And this schedule is followed for 24 hours. After 24 hours, the fever was consistently down. So now it was only given every 6 hours for the next 48 hours. Here's the important part. All patients were clinically well after 72 hours. Now you have to realize with how severe the cases were upon presentation, there was no treatment, and there is still ostensibly no treatment for polio. And so they would be expected to either have a long lingering illness leading to recovery, a long illness leading to some degree of modest to severe disability or death. And in this case, after 3 days, every patient was well. 3 out of the 60 had a relapse, and so it was continued for another 2 days, every 8 to 12 hours. And where they did lumbar punctures, it was the rule to find a reversion of the spinal fluid to normal after 2 days. Then he also goes on and talks about what the methodology was for treating patients that were treated as outpatients at home using the same thing. And 2,000 milligrams by needle, I'm guessing intramuscular, but maybe he means intravenous, every 6 hours, and they also were giving some by mouth. There's one point that I would sort of emphasize here. Well, there are actually 2 points. The first point is that if you're taking vitamin C orally by mouth, there are actually 2 active transport channels in the gut that control the flow of vitamin C from the gut into the bloodstream. And so it's kind of like the Panama Canal. And if it gets crowded enough, then you can't get enough vitamin C through those channels. And so you can't get the same sort of blood levels of vitamin C as you would if you directly injected it either IV or intramuscular. And if you keep taking vitamin C orally, when it's past, how much it can transfer into the bloodstream, the vitamin C just accumulates in the gut, and it actually draws water into the gut, causing diarrhea. And so that's called bowel tolerance for vitamin C, which can be a drawback, but then again, a lot of people complain of constipation, and now you have a way of treating constipation that also is extremely healthy for you in other ways. So you kind of solve 2 problems there. But the point that I originally wanted to make was that he's saying that when you're giving it, where is it? He's noting that with intravenous administration of vitamin C, there's a peak plasma level of the vitamin in 1 to 3 hours, and then it's also excreted quickly in the urine. So the point being that you'll note when he treated these patients, he was initially giving the vitamin C every 1 to 2 hours or 2 to 4 hours, or then, depending on how they were doing, 4 to 6 or every 8 hours. So it's one thing, like if you go to a vitamin C clinic and you get like, 1 dose of 30 grams of IV vitamin C, but after 1 to 3 hours, you're going to begin spilling all that out through the urine. That's so the blood levels will not be maintained over a period of days. So it's better if you could at least have that, every day, or ideally, as Klenner did it, every 4 hours or every 6 hours or something like that. And then he just goes to say that 2 out of the 60 were regurgitating through the nose, so they're saying this might be the bulbar variant of polio, which is very dangerous. And they took precautions with that in terms of how they were positioning the patient and so on and so forth. But again, and I'm not sure who did the emphasis on this write-up, but with these precautions taken, every patient of this series recovered uneventfully within 3 to 5 days. Now, just to bring that fact home, polio was, and ostensibly still is, an incurable viral illness that will run its course and oftentimes lead to death. And all of these patients were fine, 3 to 5 days. Now he switches to talking about a different disease, another viral infection, and that is herpes zoster, which is more commonly known now as shingles. There's been a recently released vaccine of unknown efficacy for that, but shingles gets a lot of press. It's a very painful recrudescence of chickenpox, and very painful disease. Was in the news recently with Senator Feinstein having a prolonged bout of shingles, which kept her out of the Senate for a number of weeks. So they had 8 cases of adults with shingles, herpes zoster, and 7 experienced cessation of pain within 2 hours of the first injection and remained so without the use of any other analgesic medication. I'll just read that again. 7 experienced, this is shingles we're talking about. It's extremely painful disease. Cessation of pain within 2 hours of the first injection. Remained so without the use of any other analgesic medication. 7 of the cases showed drying of the vesicles within 24 hours and were clear of lesions within 72 hours. Talks about a diabetic where 90% cleared within 72 hours, but not all of them. And she had one vesicle that didn't seem to respond well to the vitamin C, but eventually cleared anyways. Notes another out of this 8 patients. One was a man of 65. He was doubled up with abdominal pain from having taken opiates for the past 36 hours. Again, a very painful recrudescence of chickenpox. He was given 3,000 milligrams of vitamin C intravenously and directed to return to the office in 4 to 5 hours. Wait a minute. Yeah. He returned in 4 hours, completely free of pain. He was given an additional 2,000 milligrams of vitamin C, and following the schedule above, he recovered completely in 3 days. Just as an aside, we won't cover it here, but vitamin C is also useful in breaking the addiction to opiates. Here, he doesn't give a great deal of detail, but he's noting that herpes simplex also responded to the treatment within 3 days, and that in some cases the B vitamin riboflavin appeared to cause faster healing. Chickenpox, the precursor to shingles, also gave an equally good response. Not sure what happened to the formatting, but then he goes on to talk about influenza. That one gets a lot of press too. And the size of the dose and number of injections required were in direct proportion to the fever curve and the duration of illness. So it was useful in treating influenza. The response of virus encephalitis to ascorbic acid therapy was dramatic. So viral encephalitis is a bad thing. And what it means is that the virus has gotten into sort of the holy of holies, the central nervous system. And if there, it can mess up your brain. And it can happen from a number of different viruses, but if the virus gets into the central nervous system, it's a big problem. So he's saying that there was a dramatic response here, and he had 6 cases of viral encephalitis, 2 from viral pneumonia, 1 chickenpox, 1 from mumps, 1 from measles, 1 from mumps and measles. So he goes on in detail and talks in detail about one of these 6 cases, and this was a lad of 8 years. This was the one who had both measles and mumps, and the poor kid was in a bad way. He had a temperature of 104, lethargic, irritable, and anorexic. He wasn't eating, generalized headache, and then he became stuporous. He just is sitting there staring at the wall. And so he was normally very healthy, and so on and so forth. He was given 2,000 milligrams of vitamin C intravenously, 2 grams intravenously, allowed to return home because they didn't have any hospital beds at the time. And his mother was asked to check on him. The memorandum revealed a quick response to the antibiotic. After 2 hours, he asked for food and ate a hearty supper, then played about the house as usual. Then 6 hours after the initial injection, he began to revert. Again, remember, the vitamin C in the plasma is being excreted out in the urine. So when seen the second time, temperature was 101.6 versus 104. And he was in a bad way, but not nearly like when he first presented. So they gave a second injection. And so after the second injection, he was fever, and they also gave him now 1 gram by mouth every day. And the next day he was fever and symptom free. So as a precautionary measure, another 2 milligrams was given, and he was told to continue the drug by mouth for the next 2 days. And that's the end of it. No more viral encephalitis, a very serious condition. Talks about another case, a lad of 12 years had headache, and this was after mumps. He got viral encephalitis, and a fever of 105. He was admitted to the hospital, given 2 grams vitamin C IV, and then 1,000 milligrams every 2 hours. Following the 3rd injection, so that would be 4 grams, he was sitting up in bed, laughing, talking, begging for food, and completely without pain. He was discharged in a day, clinically well since relapses do occur. He was given 2,000 milligrams of vitamin C every 12 hours for another 2 days. Here he's talking about using the vitamin C prophylactically to prevent measles, and noting that when it was given IV, people wouldn't get measles. Given by mouth, it was less effective. It modified the course of the disease, but there wasn't a high enough blood level to completely eliminate any infection. And he's further saying that if it was taken orally, if the drug was discontinued or reduced to 3 or 4 doses, within another 2 days, the disease would be back. And this next paragraph can be filed in the, I don't think this would make it past an institutional review board nowadays. But then again, he's actually helping people as opposed to much of the modern medicine, or should I say industry. He says it was our privilege to observe this picture over and over in 2 little volunteer girls for 30 days. These research helpers were my own little daughters. So he was giving them 12 grams by mouth every 24 hours for 4 days, and the virus would go away, but then it would come back. And let's see. So he initially was trying to cure them with oral vitamin C, and it kept returning, and so he eventually just got rid of it with 3 or 4 1 milligram injections of vitamin C at 6-hour intervals, and then it was gone. And that's also notable that if you're taking vitamin C orally, it may not be enough It may do something like keep a virus at bay or something, but it by itself will likely not be sufficient to clear out a virus entirely. So if you're taking it orally, it should be taken in conjunction with other things that would be effective in reducing the duration of the viral illness. So moving on, now we're not talking about encephalitis, but people with mumps, 33 cases, vitamin C given at the peak of infection, fever gone within 24 hours, pain gone within 36 hours, the swelling of the mumps was gone within 48 to 72 hours. 2 cases were complicated with orchitis, that is testicular swelling, and so he's talking, in those 33 cases, there was a 23-year-old with bilateral orchitis, severe pain, fever of 105, and was nursing testicles the size of tennis balls. Vitamin C was started at this time 1,000 milligrams every 2 hours intravenously. The pain began to subside following the first injection and ceased in 12 hours. There was no fever after 36 hours. Then he did another little experiment with 3 of the patients. One boy was given standard of care treatment and had a rough time for a week. A second was allowed to develop mumps to the point of maximal swelling, then given vitamin C every 2 to 4 hours, and he was well within 48 hours after that. The third patient was given vitamin C on the up curve when the swellings were 60% of expected. This child was well and remained so from the 3rd day of treatment. And here he goes on to point out that there was no toxicity observed with any of these treatments. And this goes back to the point I made at the start there, that in most animals, vitamin C is produced in large doses from the liver every day, and they produce more of it if they have an illness or are under stress. And humans are only lacking the fourth of the 3 enzymes, the fourth of the 4 enzymes to convert glucose to vitamin C. So whether humans previously had the ability to do this, or whether just because we're genetically similar to animals, it's just remarkably, and I'm realizing I can only talk about this one paper today, but when we talk about other papers, he goes to even higher doses, non-toxic, and he's talking about a volunteer received 100,000 milligrams in a 12-day period, and he notes here that there were no laboratory signs of toxic reaction or any clinical signs of reaction to the drug. Although sometimes when taken by mouth, people would vomit. But aside from that, there was nothing. And then he just goes back to a point he made earlier that, just as you wouldn't use a tiny aspirin tablet for kidney colic, we can't hope to destroy the virus organism with doses of 10 to 400 milligrams. And that the results which we have reported in virus diseases using vitamin C as the antibiotic may seem fantastic. These results are no different from the results we see when administering the sulfa or mold-derived penicillin types of treatments for infections, that you can get 48 to 72 hour cures. It is laying no claim to miracle working then when we say that many virus infections can be cleared within a similar time limit. And I see now the highlighting was done by our Cathcart, who is either a PhD or a physician. I think he's a physician who's well known as having done a lot of research in this area. And his last comment here is that in talking with Klenner's wife, who served as his nurse, it would indicate he used sodium ascorbate. You have to remember vitamin C is ascorbic acid, and so it needs to be buffered to the same pH as the blood, and so sodium ascorbate would be what he was using to keep it buffered, or you could buffer it perhaps with something else, but you wouldn't want to use it just in the acid form because that would be more acidic. Okay, so I had hoped to go through all of Klenner's papers that are easily available, and I'm guessing this has been like an hour just to go through one, and so I don't want to make these videos like 5 hours long every time. I wanted to make it, you know, like 10-15 minutes, but you get talking on this stuff and there's a lot to cover. So I will end this one here, but I will end with a shameless plug. This is the only thing I've put on Amazon, and I did this maybe 10-12 years ago. Vitamin C history and the case for its use in cancer. I think with what I know now and with what we've all seen from the medical industry over the past recent history, it's a little bit milk with toast, but at the same time I still think it's very good. One of the things that's useful here is that it discusses also liposomal vitamin C, and that's very important. Remember I said there are 2 active transport channels in the gut to get the vitamin C from the gut to the bloodstream. If you put the vitamin C in a liposome, the liposome is absorbed directly. So liposomal vitamin C is a way to get higher doses of vitamin C into the bloodstream when taking vitamin C by mouth. Further, it in all likelihood gets to the cell with much greater efficiency. Because what happens is the liposome is made, it should be made of the same sort of material as your cell membrane, and it just kind of merges with the cell membrane and drops like a B-52 bomb load of vitamin C right into the interior of the cell, as opposed to, I believe there are active transport channels on the cells for, as well as in the gut, for getting the vitamin C from the bloodstream into the cell, which is where it needs to be. Now, yes, liposomes have a little bit of a bad name because a liposome is also what they use to encapsulate the modified messenger RNA in the COVID shots. However, they managed to make that one toxic. I think it's got like polyethylene glycol on it, all kinds of nasty things. But if you don't do that, and Live On Labs, I have no relationship with them, but Live On Labs is, the person there has an interesting background, and he looked into this to, I believe, try to cure his cancer. I'd have to go back and check. And he has patents on how he makes the liposomes, but they should be very non-toxic. It should basically just be taking the same material as the cell membrane and using that to form a sphere around vitamin C, and then that is absorbed directly into the bloodstream the same way you would absorb fats and oils, and then it goes into the cell from there. And so again, shameless plug, but if you want to support like what I'm doing with the electronics experiments, and if you want to learn more about vitamin C, this isn't a bad place to start. Now, the reviews aren't that great. I mean, people that wrote are usually pretty excited about it. You need to read this. Amen. And then here's a 1-star. You know, sometimes I don't want to get paranoid, but I cannot see this book. I've just bought it in my Kindle library. So if you get it and it doesn't show up or something, leave me a comment either on here or on the YouTube channel, and I'll look into it and get it solved. I could just email you a copy. So again, I hope everyone enjoyed this. I think this is information that people should know about, and I hope I gave some context and some background. I've just scratched the surface. You know, he's got 28 publications. They screwed up the PubMed search engine about a decade ago, and it's hard to find things. But PubMed only indexes like 3 of his articles, although they did index this one to their credit. But it's kind of surprising given what he is saying and what he was able to accomplish and made note of in the peer-reviewed medical literature. So thank you, and we'll do more of this later. Stay healthy, everyone.